I'm Dr. Michael Westmorland. I practice in Newport, Tennessee. I practice with my wife.
And I'm Dr. Crystal Westmorland.
We've practiced separately as within different associates, in different associateships, and then about 3 years ago we started practicing together and built a new office, and started on our progress together. After practicing for about 5 years, there was a lot of cases that I saw that I really didn't know how to treat. I would get into, and I saw there were issues, but I just really didn't know where to start on these patients. And dental school doesn't prepare you for those kind of cases. They prepare you for single tooth or quadrant dentistry, but complex cases, or even what now I see are simple cases, I just really didn't know how to solve. And so one of Crystal's friends had taken a Dawson class, and she thought that might be our best place to start.
For me, we had just moved into our new building and we were getting more new patients, and there were patients that I wasn't really sure how I could take care of, and we're probably about an hour away from the closest prosthodontist, and most patients don't want to drive that far. And I had done a 1-year residency at the VA, so I knew there was probably a little something about occlusion that I hadn't really learned. And so when my friend had said that she was supplementing her education with Dawson, we started to look into it.
Before Dawson, when I would look at a patient, I would immediately come up with a treatment plan for them. It was basically caries control. Now that I'm been through all the courses, now when I see there's issues with occlusion, or people that are wanting an aesthetic change, it's straight to mounted models and working the cases up and presenting the options to patients. So that's been a big change in our practice. Before we started Dawson, we had a really busy practice. We saw probably quite a few more patients than we're seeing now, and it was single tooth dentistry, on every patient. And now that we've kind of slowed down, taken a lot more time with our comprehensive exams, more time educating patients, just really slowed the process down on the front end, and taking it to that next level.
I knew that my patients had a problem, and I knew what I wanted the end result, but I didn't know how to get there. So throughout that treatment planning course, it taught me, exactly where I needed to go. And also, most of our patients, you hear about these big treatment plans. Oh, they're going to need a big treatment plan. Well, the sequencing was very important, I think, especially in our small town, because most patients can't come in and just drop a big wad of money. I mean, you can get them stable, and as they taught in the treatment planning course, you can get them stable and just do the work, over the course of a few years, and most patients can do that. Most patients want to be healthy.
I really love the community of the Dawson Academy. All the instructors, and we've had the good fortune of working with many of them throughout the classes, and they've all been just fantastic towards us. I mean, immediately you feel like, this is a great mentor for me. Just really willing to help us with anything. And it's been, and the other participants in the classes have met some really, really good friends in these classes, because they're going on this same journey, and we've got the same outlook on dentistry and life, and so that's been great. Probably the community. I just love coming to the classes just to see some old friends, and of course we're learning some great things here at the class, but you learn so much from the other participants too about their practices. So that's been a really big thing for me.